day everyone, my name is SHERILYN from College of Nursing N3A and welcome to my presentation. The topic of my presentation is about tuberous sclerosis.
So, what is tuberous sclerosis? Well, the first thing of tuberous sclerosis is not a tuberculosis. So, don't confuse tuberous sclerosis with tuberculosis. Tuberculosis is a bacterial in the lungs, while tuberous sclerosis is, according to National Institute of Neurological Disorder and Stroke, National Institute of Health, tuberous sclerosis, also known as tuberous sclerosis complex or TSC, is a rare genetic condition that causes many non-cancerous tumors to develop in different parts of the body. This tumor can occur in the skin, brain, kidneys, and other organs, in some cases leading to significant health problems. Tuberous sclerosis complex also causes developmental problems, and the signs and symptoms of the condition vary from person to person. Tuberous sclerosis is often detected during infancy or childhood. Some people with tuberous sclerosis have such mild signs and symptoms that the condition is not diagnosed until adulthood, or it goes undiagnosed. Tuberous sclerosis is a genetic condition caused by changes in one of two genes called TSC1 and TSC2. Changes in either of these genes can cause uncontrolled cell growth. TSC1 gene is located on chromosome 9 and directs production of protein called chromatin. The other gene, TSC2, is located on chromosome 16 and directs production of protein called tuberin. In 2/3 of cases, there is no family history of the condition and genetic change arises randomly in an individual. A child can inherit the condition if either parent has it. People with tuberous sclerosis have a 50% chance of passing the condition to their children. Affected population. Approximately 15,000 people in the United States have TSC, and as many 2 million people worldwide are believed to have the disorder. TSC occurs in all races and ethnic groups and in both genders. Males and females are affected in equal numbers. The disease affects an estimated 1 in 6,000 newborns. About 1/3 of all people with TSC genetically inherited the disease, while in the remaining individual, the disease is acquired as a result of spontaneous genetic mutation. The signs and symptoms. Tuberous sclerosis can result in a range of associated health problems. Symptoms can range from mild to severe, depending on the size or location of the overgrowth. Although the signs and symptoms are unique for each other with tuberous sclerosis, they can include skin abnormalities, seizures, cognitive disabilities, behavioral problems, kidney problems, heart issue, lung problems, and lastly, eye abnormalities. The first signs and symptoms is seizure, the most common neurological symptoms of TLC. It is a growth in the brain may be associated with seizure, which can be the first symptoms of tuberous sclerosis. Children, a common type of seizure called infantile spasm show up as repetitive spasm of the head and legs. According to the American Epilepsy Society, an infantile spasm can consist of something as simple and slight as a head drop. They more commonly involve a series of sudden, jerking movement of the legs and arms with the bending of the waist or a fast drop of the head. According to Epilepsy Foundation, seek emergency medical attention if a seizure lasts for more than 5 minutes or there is no recovery in between seizure. And watch this video if you notice a seizure in your loved one or if you see someone having seizure.
Put something soft under my head so it doesn't bump on the ground. If you can, send someone to get an adult. Stay with me. My seizure won't last long. They usually only last less than 2 minutes. Make sure the other kids don't crowd around me. And don't put anything in my mouth. When my seizure stops, I'll probably be a bit tired and not thinking clearly. Just tell me I had a seizure and that it's okay.
The second sign and symptoms is skin abnormalities. Most people with tuberous sclerosis have patches of light-colored skin, or they may develop a small, harmless area of thick, smooth skin or reddish bump under or around the nails. Facial growth that begin in childhood and resemble acne also are common. And there are other skin symptoms of tuberous sclerosis. The skin rashes of tuberous sclerosis can take a range of forms including facial angiopyroma. The affected person typically develops a rash across their nose and cheeks. At first, the rash appears like a collection of red pinpoints, then each mark develops into a small lump. Facial rash that appears as spread of small pink or red spots across the cheeks and nose in a butterfly distribution. Usually appear between 3 to 10 years of age and increase in size and number until adolescence. And when the child reaches their teenage years, papules may also form around their finger and toenails. Angual fibromas may place excessive pressure on the nail matrix, resulting in the potential for extensive nail pathologic condition and pain. It is smooth, firm, flesh-colored lumps that emerge from the nail folds. Angual fibromas are more common on feet than hands. Chagrin patch. The skin patch has a texture, raised appearance similar to orange peel. These patches can be present at birth and usually form on the lower back. They can develop later in life. It is look like flesh-colored orange peel connected tissue nib for varying size. It is usually seen on the lower back. Ashley patch. Patches of skin are white because they lack of pigment. These patches tend to take the shape of lip and are sometimes present at birth or early infancy. 3 or more white spots at birth suggest the diagnosis of tuberous sclerosis.
Cognitive disability, tuberous sclerosis can be associated with development delay and sometimes cerebral disability or learning disability. Mental health disorders such as autism spectrum disorder or attention deficit hyperactivity disorder or ADHD also can occur affect some people with TSC. Developmental delay occurs in about 1/2 to 2/3 of people with TSC. Delay range from mild learning disabilities to severe impairment.
Behavioral problem. Common behavioral problems may include hyperactivity, self-injury, or aggression, or issue with social and emotional adjustment. Many people with TSC experience anxiety disorder and depression. Kidney problems. Most people with tuberous sclerosis develop non-cancerous growth in their kidneys and they may develop poor growth as they age. Heart issues. It is growth in the heart, if present, are usually largest at birth and shrink as the child gets older. Eye abnormalities. It is a growth, can appear as white patches on the light-sensitive tissue at the back of the eye or retina. This non-cancerous growth don't always interfere with vision. Lung problems. It is a growth and develop in the lungs may cause coughing or shortness of breath, especially with physical activity or exercise. Women, formation of the cysts in the lungs that may or may not cause symptoms. Men and women, overgrowth of cells in the lining of the air sac. Diagnosis of tuberous sclerosis. Tuberous sclerosis is diagnosed using some clinical tests including physical examination, magnetic resonance imaging or MRI of the brain, an imaging technique used to look for non-cancerous tumor that occur with TSC that can lead to seizure. CT scan of the head, used to detect bleeding, brain injury, and skull fracture. Electrocardiogram, test to check for heart abnormalities. Echocardiogram, it is used to look for irregularities in the heart structure. Kidney ultrasound are used to assess the size, shape, and location of the kidneys. Eye examination, which may reveal retinal abnormalities. Genetic tests for TSC used to confirm a clinical diagnosis. There is no cure for tuberous sclerosis, but there are variety of treatment that can be used for the various signs and symptoms of TSC. Treatment options may include mTOR inhibitor medicine can be used to treat brain tumor, kidney tumor, and epilepsy caused by TSC. Anti-epileptic medicine are the most common used treatment for epilepsy. Third, brain surgery if seizure cannot be controlled. It may be possible to remove lesion of the brain to reduce seizure. Skin treatment. Dermatologists can provide advice on both surgical and medical treatment for the skin signs of TSC. Occupational therapy can help children acquire skill and strategy. Speech therapy can assist communication and skill.
In summary, tuberous sclerosis is a genetic condition that can target different parts of the body to varying degrees. Its common characteristic in the formation of tuber-like growth in the brain and sometimes other organs including the kidneys, heart, liver, and the lungs. Tuberous sclerosis can cause seizures, delayed development, intellectual impairment, and mental health challenges. Firstly, don't forget to like and share my video.